You
Hi, I'm
are?
Dr. Witosky. I'm the team psychologist with Dr. Geis. I run all of the support groups, pre and post operative, and I do all of the preoperative evaluations.
Can you tell us about the support groups, like when they are?
We have a preoperative support group the first Tuesday of the month for all pre and post operative patients, very educational.
And what's covered in that? Like what
It's
type of things you talk
psychoeducational
about?
in the sense that Dr. Geis does a half-hour seminar prior to the actual support group. That's from 6:30 to 7, and then from 7 to 8 we have patients talk and interact with myself, the nutritionist, and then the other pre and post-operative patients.
Okay. What are the other?
Post-operative, we have a support group for all post-op banded patients the third Tuesday of every month at 7 p.m. in Dr. Geis's office. And then the fourth Tuesday of the month, we have a support group for patients who are a year or more out
And
after surgery.
and what type of topics do you cover in those support groups?
We cover anything from lifestyle changes to emotional eating to mindless eating to strategies to classic behavior modification techniques to dynamics around eating of the sort.
So if you had a patient that went under laparoscopic adjustable gastric banding surgery and they were a typical emotional eater, what type of advice would you give to them to be successful with the lap band?
Well, in the group setting, that's actually the most common theme that we talk about. So we go through different strategies on helping them develop alternative coping strategies rather than utilizing food inappropriately for self-soothing.
And like, you give me an example of how that's done.
Um, well, everyone's different, but overall, we'll go through different strategies such as journaling or listening to music or going for a walk or developing exercise regimens or partnering with a buddy, be it a bandit or a family member, developing support systems, all different strategies depending on the individual. So if it's an emotional eating, that's interfering with their day-to-day functioning and they're not able to really thrive post-operative, then we'll do some individual work to really narrow down what's going on. First, identify the emotion strategy and then go from there.
So if you had a patient that had specific needs, you can tailor these techniques to meet the individual patient's needs?
Absolutely. And
Sounds-
sometimes we'll move from a group into an individual for those type of scenarios.